Hi everyone, welcome back to Beyond Your Knowledge. Today we're going to be reviewing blood pressure tracings. So before we continue, I would like to share with you Romans 8:6, and says that for to set the mind on the flesh is death, but to set the mind on the spirit is life and peace. So we have two options. So we put our minds in the flesh, which our origin is sin, and sin is death, or to set the mind on the spirit, which is the Spirit of God, and give you life and give you peace. Yes, so those are the choices. Well, now we're going to start to review the blood pressure tracings. So we're going to have two axes here. So we're going to have the y-axis, okay, and the x-axis. So the y-axis is going to represent the blood pressure, okay, the blood pressure, which is measured in millimeter of mercury, and the x-axis is going to have the time. Okay, so the normal, we're going to see first the normal pressure tracings. So first we're going to see the normal. Okay, and then we're going to see if there is any so the first one, we can start with the left atrium. So we're going to do left atrium, this blue here, and the left to put the numbers here. So the pressure is 0, for example. You continue until 100. So 10, 20, 30, 40, 50, 60, 70, 80, 90, 100. Okay, 110, and then 120 probably. So let's just see one more, because you see the pressure. Remember, our pressure is 120. 120. Here we go. Okay, now we are ready to trace the lines. So we're going to start with the left atrium. Normally the left atrium has a pressure less than 10, so that means that it's going to look like something like that. So start here, approximately 5, go up to 10, and then come down to 5, go up to 10, 5, 10, 5, 10, 5, 10. So this is approximately, this is the left atrium. Well, after the left atrium, which one do you think that come the left ventricle? So the left ventricle, we're going to do it in orange. So the left ventricle has a pressure of 0. So and then so starting 0, then you move on a little bit here, and then here you will go up all the way up until 120. So which is going to be all the way up. So I think the right there is 120 approximately. Okay, and then you come down. Okay, and you come down, and then you have this, go straight down, go straight down until you get your almost 0 again. So you get here and you go up. Okay, and then you go up all the way up until 120. Come down, and then you come. So this is the left ventricle. And then you have the aorta. The aorta, we're going to do in red. The pressure of the aorta starts in approximately 70. So you have your 50, your 60, your 70. So approximately in the 70, the pressure of the aorta starts, but in the time start approximately here. Okay, now start, and then go all the way up. It's going to have the basically and reach almost 120 and go down to 100. Need to raise a little bit here. There you go. Yeah. Okay, so come here. Oops, sorry. And then go back, goes down until basically the same. Go up again. And then come down, and this is the aorta. Got it? Yep. Yeah, this is the normal pressure tracings. Well, now with that in mind, I think that we can talk about if there is a mitral insufficiency. Okay, so let's just open a new slide, and then we're going to talk about of mitral insufficiency tracings. But I will copy the normal that we saw. I will paste it here. I will paste it. Okay, I will paste it. I will keep it here on this corner. This is the normal. Okay, this one is the normal one. Okay, so let's just yeah, and this tiny one is the normal one. Okay, and now we're going to do the big one. Okay, so we can use the same pattern that we had before and just see what is the okay. So in mitral valve insufficiency, so your remember that your heart has 4 chambers. Okay, so how many chambers? 4. So let's just say I will do here on red. Oh no, let me just use another color. Yeah, okay, red is okay because representing the heart. The heart has 4 chambers, so have 2 atriums and 2 ventricles. So, and then has a valve in each of those. Okay, and then has this aorta exit here. So this is the aorta. Okay, so this is your left atrium, no, actually it's your right. yeah, your right atrium, your right ventricle, your left atrium, and your left ventricle, and then you have valves there. So this is a mitral valve, and then this is the tricuspid valve. Okay, so now the blood, the blood comes from the superior inferior vena cava. Okay, so here is going to be used in blue, superior vena cava and inferior vena cava. Okay, now and then go to your lungs through the pulmonary arteries. Okay, well, then yeah, what should be here? So and then just go there, and this is your, yeah, so this is your pulmonary artery. Remember, this is the only artery that has the oxygenated blood. Okay, and then come back to the heart, to the pulmonary vein, to the left atrium. Okay, it's the only vein that has oxygenated blood in an adult. Got it? Now, if the patient has a mitral valve insufficiency, so that means that your valve, which is between your left atrium and your left ventricle, is going to be affected. So, but the pressure in each of those, the aorta, so the aorta will have the same pressure. Okay, the left ventricle is going to have the same pressure, but the pressure of the left atrium is going to increase, because when the valve closes, because it's weak, so cannot. So that means that this one here, so now your left atrium is going to have more pressure, less pressure, so it's going to have more pressure. Okay, so all this is going to be because now you have, so now you have more pressure because you might have insufficiency. And now let's just check how. Let's go. So basically you start at the bottom, as you start here. Okay, so you start here, 0, so but then 0, then you go up here, and then you go at pressure as high as 40s. Okay, and then you come down. Okay, and then you come down again. Oops, sorry. So you come down, and then yep, and then you go up again, and then you go down, and then yep, there we go, left atrium. So this is the mitral valve insufficiency in the trace lines. Remember that if the valve is not closing well when the ventricle pump, so the blood comes up to the left atrium, and the pressure in the left atrium is going to increase. Okay, so basically this is that of these tracing lines with the mitral and the normal pressure that we saw. So one more point here. So this wave in the left atrium is called the V wave. Got it? Okay. Well, thank you so much for watching. Remember, we can do all things through Christ who strengthens us. God bless you all.